There are many people that believe that if they're struggling with a mental illness, that all that's required to treat the symptoms are medications. Although medications can be effective as part of an overall treatment plan, which includes individual or group therapy, there are many factors that are considered when addressing the wide range of mental health conditions. There have been instances when doctors see patients that are on numerous medications but continue to report no progress in recovery. In addition, addiction can also take its toll on certain individuals that become reliant on the very medications that are intended to improve their lives. To discuss medications and mental illness in greater detail, I'm pleased to introduce this month's guest, Dr. Steve Sobel, NCSS Medical Director. Dr. Sobel, I want to welcome you to the program.
Thanks.
Well, let's start with, so a patient sits down and says, I have a chemical imbalance. All I want is meds to feel better. What's wrong with this picture?
Well, basically it's not that simple. We can't really reduce a person and their suffering to a few chemical reactions gone astray. So usually there's not really just some magical pill that will take care of this, and there's not really a quick fix. It's not unusual that a medication alone would be adequate. And this idea that we have specific treatments for specific chemical imbalances that we know about is a bit of a myth, really. So we have to look at, is it a diagnosis that might be treatable with medications, and would therapy be more effective or more appropriate? Is there a medical problem that might be contributing to some of the symptoms, or substance abuse going on? And again, not all distress can really be treated by medication. So if it's trauma related, for example, that might be better addressed through therapy, or sometimes what's called mood swings is more of a characterological problem that would be addressed through therapy. And we have to look at the whole context. Like, there might be a lot of stressful things going on, there might be unemployment, financial issues, relationship issues, legal issues, abuse, and so on. So and at a full comprehensive mental health agency, we can try to help with a lot of those issues as well. So if we just focus entirely on medication solutions, that may actually delay response, because we'd be barking up the wrong tree, basically.